Welcome to the Digital Health and Innovation Podcast, a publication of the Southern Medical Association. This podcast will educate and inform listeners on the various systems and methods that use information, data, and communication technologies to help resolve problems, reduce inefficiencies and costs, improve access, increase quality, and help make the practice of medicine more personalized and precise.
This is our third podcast of our Kaizen series with Dr. Migita. Thank you again, Dr. Migita, for being with us. Over the past couple of sessions, you mentioned your sensei a few times. Can you tell us a little bit about your sensei, please?
Sure, I'd be happy to. Anyone in healthcare who's looking to increase their skill set, and anyone in healthcare who's looking to bring the ideas and concepts from another industry into their own, really needs a sensei to help you guide them through this, because it's you're going to have questions and you're going to need guidance, and not just guidance from an occasional email or an occasional phone call, but real guidance, a sensei standing by your side and really helping you through the transformation that you want to achieve. So my sensei's name is Jun Nakamura, and he has learned the Taiichi Ohno method of TPS and of Kaizen directly from a man named Hitoshi Yamada. Now, Sensei Yamada, he trained directly with Taiichi Ohno. So the training that Sensei Nakamura has given me, it really comes directly from the source, I feel. Hitoshi Yamada is a name that's not well known here in the United States, but in Japan he's very well known. He's practically a celebrity. He helped turn around companies that like Canon and Sony and NEC, so really large manufacturing industries. Nakamura Sensei, my sensei, trained for years under Yamada, and Yamada actually officially recognized him and endorsed him to be a successor to Taiichi Ohno's TPS legacy. Everything I know about Lean, everything I know about TPS, everything I know about standard work and Kaizen comes from Nakamura. So he's been a pivotal person in my life. I've had other senseis throughout my years here, but his mastery of this information it's second to none, really, in my experience.
That's fascinating. Thank you for sharing that with us. I've got a couple of questions for you. If people in healthcare said, our doctors, nurses, our staff went through many, many years of school and training, how does the standard work apply to them?
Well, I think to answer this question, the first thing people need to understand is that Kaizen or change is really intended. Change, it can be it can have large scale change and small scale change, but Kaizen, when you try new ideas and find something that works better, the idea is to apply that improvement to standard work. So yes, they've gone through years of school and training, and that's important, because who is standard work really for? Well, in order to employ standard work and to follow standard work, the people who are doing it need to have the skills and the knowledge that are requisite to the steps, to understand the steps within standard work. So take, for example, our clinical standard work pathways. The users of our pathways won't be able to use the standard work unless they've gone to medical school or gone to nursing school. So you need a baseline level of training to employ standard work. Standard work is not designed, whether it's in healthcare or industry, standard work is not designed to be just picked up by anyone and just performed. Standard work, it's the training manual. It's the training manual of how the work is actually accomplished. And this is a fundamental concept that most people they simply don't understand. And this training module, this manual, this piece of standard work is designed to be refined over time. It really represents the sum total of your organization's expertise. So when you start to think about employing standard work, the key first step is finding those experts who write the standard work initially. And the goal is to find the work that's really the most fundamental. That's really where you start. So standard work does apply to them. It applies to everyone. It applies to the trainers and it applies to the trainees. It's a method for improvement that really healthcare is ripe for this.
So as a physician, I'm a strong believer that medicine is an art, and each patient is different. So some people may argue that the standard work would turn people into robots. What do you think of that?
You hear this argument commonly, and it's something that no matter what industry you're in, when you start talking about this, you'll get this comment. It's cookbook medicine, or people will stop thinking for themselves. So is medicine an art? I couldn't agree more with you, Reza, that it is. It is an art. But think about art for just a minute, I'd say. Think about art. What does a painter have? A painter has brushes, a painter has their easel, and they have paint. And they lay out these materials in front of them in what really amounts to a standard way. They're laid out in front of the artist, but the brushes, the paint, it doesn't create the masterpiece. It's the artist that creates the masterpiece. It's the person. And that artist has to discover new ways to inject emotion into their art. They have to master the way of creating perspective and scale and lighting and expressing that on canvas. So I would almost guarantee you, Reza, I would guarantee you that the great artists of the world, that they refine their skills by trial and error, by Kaizen, and that when they found a better way, they standardized that and they used it for their next masterpiece. So if you look at any of the great works or any piece of art that is there to be appreciated, that came from hard work and refinement. And it's no different in medicine.
So why do I have to do a standard work the same way every time?
Well, this is another misconception. Standard work is not designed to be done the same way every time. It's the basis for improvement. You do not write standard work and sit back and say, there, I've done it, and now it's never going to change again. It's not designed to be static. There's a great story of Taiichi Ohno. He used to walk into the factory floor and pick up pieces of standard work that are displayed in front of various stations on the production line, and he would become very angry if he saw that the standard work had not been refined recently. He'd say, "You're not doing anything. You're not doing anything." So imagine that, an entire factory of people working very diligently to create products, error-free products in the shortest time frame, and the big boss shows up and tells them that they're not doing enough. So this is the spirit of change, of Kaizen, of improvement. So how many healthcare executives do you know that have that degree of courage to do what Taiichi Ohno did? I'd argue there are very few that have that amount of courage. It's again, something that takes a huge amount of commitment to start down this path and really do it right.
So this is one of the arguments that I hear all the time is that we don't need to test, train, and standard work because people already know how to do X, Y, Z.
Well, do they already know how to do it? Everyone does a job. Everyone performs the tasks in front of them. And I would say, that's fantastic. Congratulations, you know how to do it. And I wouldn't say this in a sort of sarcastic way. I would say, now that you know how to do it, show me how to do it. Then the next thing I would say is what are the two components of standard work? Well, one is the steps it takes to produce your error-free product. But it's also, standard work also, the second component is time. So how long is it taking you to do that? How much time do you spend during rework or fixing errors that you made? It's very important that everyone can perform each step, but it's also important that everyone can perform each step in a specified time. Think about a pharmacy. I need a medication at the bedside as soon as possible to help cure this patient. I don't want to wait 5 hours for it. I want it to be there when I need it. So you can imagine processes in the pharmacy that not only create the product delivers the product in the right concentration, the right formulation for the right patient, but that product comes to you quickly. Time is harm for patients. One of the pillars of quality is timeliness. No one would argue with this. So if you have processes that you aren't tracking, then you can always fall back and say your process is perfect. So if you're not tracking your processes, you're saying the status quo is okay. And you've made the status quo untouchable by not tracking it. So I get back to that question from the last podcast. What do you want? Do you want the status quo, or do you want to improve? It takes a lot of courage to choose the latter.
So how can I provide personalized care and service by following the standard work?
Standard work isn't designed for that. And that might take people, may send some people into a mode of thinking that we shouldn't do it. Standard work is not designed for that. Standard work ensures that the work you do is easier, that the work you must do is easier and more efficient. What do you do with that extra time that it saves you? Well, now you can customize your care to the patient. So the concept of standard work and artistic expression and innovation go hand in hand. They're not mutually exclusive. I am much more likely to change something in my environment that I know will be standardized immediately, and I can see very quickly if that change is an improvement or not. So in a way, having standard work increases the courage to try new things. It's somewhat of a paradox, and it's hard to explain in words, but once teams begin to experience this and begin to see success and run a few PDCA cycles, as I mentioned earlier, it's an addictive process. So I think about our clinical standard work pathways and our asthma pathway, for instance. We standardize time points which we reevaluate the patient and decide if we can wean their medications as they improve. When I did my training here at Seattle Children's, we did not have an asthma pathway. So I had to remember to go back to the bedside and evaluate the patient and decide if I could reduce their medications. Now, this is all done by respiratory therapists and very experienced nurses. Is that personal care? Well, some might say that's robotic, but what does it give me time to do? It gives me time to go and spend more time with the families who need, extra support. It gives me more time to think about those complicated patients that really aren't appropriate for pathways. I tell residents here, put the patient on the clinical standard work pathway. If they're not improving, you're on the wrong pathway, and you must think outside of the box. So this is really it's actually a safety device to give people more time to find and attend to those things that are not normal, and that saves lives.
So some people may argue that, I already know the root cause of the problem. It's because my colleague John, Susie, Amanda doesn't do it right. So it makes no sense to attack the process and not the people. In this case, it is the person. How would you respond to that?
Well, there's this idea of blame, and blame is pervasive in our society, in our culture. Blame really, prevents us from feeling empathy towards other people, and blame is easy and quick, and we go there immediately. But there's a saying when you're looking to do Kaizen and you're looking to find the root cause, is that when you do your 5 whys analysis to get to the root cause, that 5 whys analysis cannot end in a person. And it's both a philosophical concept and a logical one as well, in that the errors come from the behaviors and the steps. The errors come from processes that are not optimized. I wouldn't argue that sometimes you have an actively disruptive person that may be purposely doing something wrong, but that's rare. That is rare, especially in healthcare systems, especially in children's hospitals. We are all here for the same reason. So I would say to that person that has identified another human as the root cause, I would say, have you found the root cause? Can you show me your 5 whys analysis? Can you show me your FMEA analysis? It might be great to do a podcast on FMEA now that I'm thinking about it. And I'd also ask healthcare executives, of who have tried to do 5 whys analyses, how many 5 why analyses have come across their desk that are truly complete, that have gone 5 levels deep, that have actually found the root cause of the problem, and then successfully designed a countermeasure for that. Even here at Seattle Children's, and we have a fantastic culture of change here. It's marvelous. I still don't see really complete 5 whys analyses that often from the staff. So we all have room to improve.
So my final question for you is actually something that I'm also very interested to know about this. You've gone to Japan, right?
Yes, I've been very fortunate, and I am indebted to my institution for sending me. Yes, I've been twice actually.
So why go to Japan?
It's a question that it's about the experience. It's about seeing the concepts at the source. It is life-changing. I think you see what is possible on scales that you can actually not even imagine. There are various groups that send folks to Japan. I mentioned Nakamura, my sensei. His group does send folks to Japan. I think the best way to answer is those who are wondering should talk to people who have gone. I could go on for hours about what going there has done for me. So I would invite others to maybe contact me directly or contact my sensei directly, and we can give you more information about what you can learn there. It's quite an experience.
Thank you again, Dr. Migita, for coming on online and discussing these issues on Kaizen and Lean. We would love to have you back for other important topics in healthcare and quality improvement. And for our audience, stay tuned for our upcoming podcast as we will dive deeper into these topics with Dr. Migita and other physicians from Seattle Children's and University of Washington. Thank you very much again, Dr. Migita.
Thank you.
Thank you for joining us. To subscribe to additional podcasts, visit sma.org/podcasts.